A very good morning. Today let's discuss on a timing of intervention of a common congenital heart disease. So first we'll have a separate videos for each of the congenital heart disease. Today let's discuss only on our atrial septal defect. So atrial septal defect is ASD. It constitutes around 15 to 20% of all your congenital heart disease. So this contributes to around 15 to 20% of your congenital heart disease. So the classification of ASD based on the location. So as everybody knows, first one is your ostium secundum ASD, which is most common one, which is contributes around 75%. Second one is your ostium primum ASD, which is around 15 to 20%. Third is your sinus venosus ASD, which is around 5 to 10%, and fourth is your coronary sinus ASD, which is around less than 1%. This is your classification of your ASD based on the location of the defect present in the septum. So what is the time period of a spontaneous closure? For some of your ASD will have a spontaneous closure. So till how long you can wait and what all the condition you can wait for a spontaneous closure. So the spontaneous closure will occur only in your ostium secundum ASD, right? So spontaneous closure is possible only in ostium secundum ASD. That too, when an ostium secundum ASD measuring of less than 5 millimeter at birth will go in for a spontaneous closure. So which are the condition there won't be any spontaneous closure? So unlikely, I'll write it here, unlikely of spontaneous closure. So unlikely of spontaneous closures are, first one, a large ASD which is measuring more than 8 millimeter at birth is unlikely to close. Second one, spontaneous closure beyond 2 to 3 years of age will not occur. Okay. Next, and it will not occur in other types of ASD. Only in ostium secundum ASD you can expect a spontaneous closure. So does not occur in other types, right? Next, when you have to intervene, timing of intervention, that is our topic proper. So timing of intervention in a child with a ASD. Supposing if it is an asymptomatic child. So what is the timing of intervention in an ostium secundum ASD? It is around 2 to 4 years of age. In a child with sinus venosus ASD without any symptoms, then it is 4 to 5 years. In an ostium primum ASD, the timing of intervention is also between 2 to 3 years of age. Usually ostium primum ASD is mostly associated with cleft in an anterior mitral leaflet. So that will resulting in mitral regurgitation. So surgery is considered if the child is having a significant mitral regurgitation. So in an ostium primum ASD, if the child has a significant MR, that is mitral regurgitation, then there is a surgery should be considered earlier, right? Yes. Next, in symptomatic children, when you should intervene. So what are the symptoms when you should intervene? When there is an ASD, I'll write it here, in the symptoms, that is when you have a ASD which is having a left to right shunt, that is causing right ventricular overload, RV overload, then it requires a closure, right? So when there is a presence of irreversible pulmonary arterial hypertension or pulmonary vascular disease, it will be a contraindication for your closure. Okay, so this is the timing of intervention for an asymptomatic child and also for a symptomatic child. The age group, that is for ostium secundum ASD, it is between 2 to 4 years. For sinus venusus ASD, it is 4 to 5 years. For ostium primum ASD, it is 2 to 3 years. If the child has a significant mitral regurgitation with ostium primum ASD, then the surgery should be considered earlier. Okay, clear? Yes. Next, what are the mode of closure? So you have two modes of closure. One is your device closure, another one is your surgical closure, right? So one is device closure, another one is your surgical closure. Device closure is possible only in cases of ostium secundum ASD only. So device closure is mostly feasible only in ostium secundum ASD. So the ideal candidate for your device closure are children weighing, that is weight of the child should be more than 10 kg, having an ostium secundum ASD with an adequate trim. Okay, are the ideal candidate for the device closure, right? First point. If the child has undergone a device closure, then the child should take an antiplatelet therapy, that is your aspirin, with the dose of 3 to 5 mg per kg per day for a period of 6 months, right? Yes. Surgical closure. So who are the candidates for your surgical closure? So the child with an ostium secundum ASD with inadequate trim. This is inadequate. With inadequate trim, or those with other conditions like when it is associated with partial anomalous pulmonary venous drainage, then you do a surgical closure. Second, other ASD, that is ostium primum ASD. Third will be your sinus venous ASD. These are the children who require a surgical closure. So the children undergoing both device closure or the surgical closure, they will be requiring a infective endocarditis prophylaxis. So they should be given infective endocarditis prophylaxis, right? Both device closure and also for your surgical closure, they should take your infective endocarditis prophylaxis for a duration of around 6 months. So this is a small topic regarding your this timing of intervention for a children with ASD. This one everybody should remember because this is very useful for your clinical purpose and also for your theory exam also, and for Viva session also you can have this type of questions. Thank you all for your patience listening. Next topic we'll be seeing on your ventricular septal defect, that is a VSD, timing of closure in a child with VSD. Thank you. Have a nice day.